Well, tonight we are continuing to follow the rise in coronavirus variants here in the state and in Kern County, beginning with a quick update on our local COVID case numbers for Kern released by Public Health. 269 new cases of the virus were announced today, bringing that total to 114,079 infections since the pandemic began. One new death also reported, raising that total to 1,427. No new Delta variant cases today. Those stand at 39. The director of Kern County Public Health says that a drop in COVID-19 precautions may have led to that recent increase. And as 23 ABC's Taylor LEVESQUE joins us now live in Bakersfield with an in-depth look at how the state of California is tracking those COVID-19 variant cases. Good evening, Taylor.
I spoke to Kern County Public Health today, who told me in the month of June, only 14% of positive COVID-19 tests were also tested for variants. But if you were infected by a variant, you would never be notified.
The labs are not reaching out to inform residents if they have been impacted by a variant.
Michelle Corson with Kern County Public Health says the state refers to variant testing as genome sequencing, which is a second testing process to trace variants, and the process isn't a simple one.
You can't just walk in and say, I want to be tested for one of the variants. It doesn't work like that. They're two complete separate tests. And so the whole genome sequencing is being done at the state level in partnership with labs across the state and other groups that are taking these positive cases. They're running through the whole genome sequencing to determine if indeed they are a variant, so that they can study and track and learn more about these variants and how they're impacting our communities.
Corson also says a variant diagnosis would not change the preventative measures a person takes.
If you're tested positive for COVID-19, regardless of whether or not it was a variant, the steps will be the same in your healing process and your protective measures, etc.
However, variants remain a cause for concern.
What is being revealed about these variants are the transmissibility being higher, potential for more severe illness and death, and then also the way that it responds to treatments.
According to Public Health in the state, younger people remain a cause for concern since 57% of cases are people 18 to 49 years old.
The majority of new cases in California have been identified as the Delta variant. The majority of the cases and hospitalizations are those that are unvaccinated. So we are beginning to see increases across the board when we begin looking over the past 3 weeks in particular.
Corson said there has been an increase in vaccinations of Kern County residents. 49% of Kern County residents are now vaccinated, which was a 27% increase in the last 3 weeks. Live in Bakersfield, Taylor LEVESQUE, 23 ABC News, connecting you.